Joining us first today is Dr. Thomas Cox, a pediatrician at our Oshkosh Pediatrics Clinics. Dr. Cox, thanks so much for being with us.
Of course.
We would really like to talk about what parents and teens, some of the questions that they have. We're going to play a game called Ask the Doc, Teen Edition. So we're going to have you tap on the buzzer, and it's going to give us a topic, and we're going to talk through that topic.
All right.
All right, go ahead and hit the buzzer for our first one. All right, up first on the board, vaccines. This topic here, elementary school, middle school, vaccine recommendations are changing. What are some of the things that parents should know?
By this age range, once we're getting into early adolescence, we have completed most of our primary series of vaccines, and we're moving toward those boosters and a few additional vaccines that we haven't received yet in early childhood. So some of the really big important ones, rapid fire. So we get our Tdap booster that protects against tetanus, some conditions called diphtheria, and then of course pertussis, whooping cough. And then we have our meningitis vaccine or meningococcal vaccine. It's a fancy way of describing an infection that's really bad, infects the covering of the brain, and so is very, very harmful. We like to avoid that, obviously. And then the other one would be HPV, so that protects against a viral infection that causes most cases of cervical cancer, and so that's something that only affects girls, right? The other component that's worth noting is the neck cancer, which of course can affect both boys and girls, but even more important than that is that vaccinating both boys and girls prevents the transmission of the virus in the first place. So that's part of the broader importance of making sure we have population-wide immunity to these kinds of conditions to make sure all of our children are protected.
Perfect, thanks for talking through vaccines. Do you want to hit the buzzer for our next topic?
All right.
Teen and tween skincare, the craze that is happening. I have a tween myself who has more skincare than I even knew was possible. What are some of the things that you're discussing with parents and caregivers when it comes to those expensive skincare products and routines?
Mm-hmm. With a lot of these branded products and increasing the complexity of those routines, sometimes that can cause more irritation and more harm than it can actually be beneficial. So, the adolescent skin is very sensitive. It's sensitive to hormonal changes. And then, if we have conditions like eczema and stuff like that where we're predisposed to skin irritation, what I always say is keep it simple. A gentle moisturizer goes a long way, especially without the additives, the scents and things like that that can be skin irritants. And, if we are struggling with acne or something like that, I think that's a good time to stop in and talk with a doctor like me about lots of the different options we have for getting those to go away. But I think the first thing, the biggest thing, is making sure that we're using those gentle skincare routines.
Okay, our buzzer for the next topic. Mood changes. Okay, teens, they are going through a lot. They are changing rapidly. They feel social pressures, mental health challenges at times, academic pressure. What are some things that we can tell our teens and parents to help them along this way?
These sorts of changes are totally normal, and a big part of adolescence is learning to sort of accommodate, to cope with, and to move past those sorts of challenges. And so what I always like to talk about is having a really good support system at home, as a parent, being there for the child and listening to the problems that they're experiencing and taking them really seriously. Sometimes for adults, some of these things can seem trivial, once we've moved past the adolescent years, it kind of makes you wonder, this doesn't seem like such a big deal.
But it's important to them.
Right, exactly. So offer them that space to talk about these kinds of things and have down-to-earth, non-judgmental conversations that really reinforce good interpersonal relationships, good coping mechanisms and coping skills and things like that. All of that being said, sometimes we have problems that are a little bit more severe than that, right? And those are the situations where I think it's really important if we recognize that, as a parent, to really talk to a doctor about those sorts of things, because sometimes in situations like that, we've moved past the normal adolescent stressor more into the realm of, depression, anxiety, and things like that, which unfortunately happen frequently in some of our adolescent kids. So
these are all great recommendations. All right, Dr. Cox, our next topic here. Finding balance. All right, teens, they are becoming increasingly independent as they get older, and sometimes it's hard to help them navigate. You want to be there for them, but you also want to help them feel independent and start to make decisions on their own. What are some things that you are telling families as they come in to see you when we're looking to find the balance?
Right, so one of the biggest things that we start doing in those early adolescent years, generally around 10 to 11, but it's variable, is allowing some time for a confidential sort of one-on-one period of time during these visits with the kids. That means no parents in the room, just the doctor and the kiddo. And the reason for that, it allows for a setting in which we're in a sort of stress-free situation where we feel fully open with the doctor to communicate anything that's bothering us. As we approach adulthood, we're going to have more and more independence with these visits. So that can be anywhere from them doing most of the talking, right? Talking about the problems they're having, asking any questions, even if parents are there, and then eventually coming to these visits on their own.
You want to set them up for success early.
Exactly.
One of those components is thinking about an advanced care planning directive. What are some things that, kids need to think about when it comes to planning for the future?
It is kind of a heavy topic for our adolescents, but it is something that's also very important. So if for whatever reason our adolescent or young adult isn't able to make a decision for themselves, who is going to be that person where that was needed?
Perfect. All right, our next topic here. Maintaining confidentiality. Same kind of topic here, but there are a lot of heavy topics that our teens are bringing forward. Social pressures, it could be drug or substance abuse concerns. What are some things that you are, communicating with patients and families when it comes to being confidential and maintaining that trust?
Everything that we talk about is confidential with the exception of just a few small things. So for example, if we talk about wanting to harm ourselves or someone else, that is an indication to break the confidentiality and really make sure other people are aware of that. But for the most part, anything that we talk about is going to be confidential, both to preserve that doctor-patient relationship and again, to foster independence that later on we're going to have when we're going to these visits on our own.
Yeah, setting them up for success.
Exactly.
All right, Dr. Cox, this has been so informative. You are wonderful. Thank you so much for all those tips and recommendations.
Of course.